The title of my talk is Your Money and Your Life, Real American Healthcare Crisis. And we'll begin by talking about healthcare in America before World War II. Really, there was a dominance of rural and home-based care, and it was all based on the physician who came to your house with a black bag to provide very limited services, and you usually paid them in chickens or cash or whatever was on hand. After the war, we had a booming economy with urbanization. Medicine started to specialize healthcare with an explosion of products, services, and specialists, dermatologists, ophthalmologists. Those guys came about around this time. And with this came a concomitant growth of health insurance. Anybody know about the first health insurance plan really in the country? And before World War II, there was not much health insurance at all. And the first plan was formed in Dallas, Texas in 1929. And a group of school teachers formed an agreement with Baylor Hospital to provide them with 3 weeks of maternity care for $6 a year. That was the first Blue Cross plan in the country. After the war, which represented an industrial revolution for the U.S., millions entered the workforce. You had a competition for best workers, including women now, starting to enter the workforce. But would you believe during the 40s and the early 50s there were federal wage and price controls in place? Talk about a hot political topic today, but they were in place back then. So you couldn't just offer all these incredibly high salaries and beat out the competition. So you started, if you were an employer, you had to start offering things called perquisites, what we call perks today. And out of this grew the employer sponsorship of health benefits. In the 50s through the 70s, you had a coming of age of the concept of health insurance. There was a further development of medicines and procedures in health care. Prior to 1940, 90% of babies were born at home. After 1940, now that flip-flops, 90% of babies are born in the hospital. And with this increased utilization, you have rising claims to the insurance companies that led to higher premiums. And here I like to make the analogy of a water hose, if you will. If you're the insurance company and you've got your handle on the spigot, you can just raise, and I'm sorry for the insurance guys here in the audience today, anybody that's health insurance, we're going to talk about you. So, if you're a health insurance company, you can just raise your premiums and put more water or money into the hose. But they put some very smart people on how to put a nozzle on the other end of the hose. And that's where they really got control. And if you can control the inflow and the outflow of the water in the hose, then imagine the possibilities. Well, they figured it out, and they did so with what I consider to be the worst thing that's ever happened to American healthcare, and that's the $5 copay. I'll talk about that here more in a minute. But with the growth and consolidation of insurance companies, they reached out to this employer-based health insurance system, and it became easy pickings for them because rather than going door to door, they could just reach out to hundreds, if not thousands, of potential clients at a time. So much so that by the 80s, we had the concept of managed care that was born. The HMO, Health Maintenance Organizations. These promised to control costs, but really what it gave the insurance company was power over the premiums and the payments. It gave them control over both ends of the water hose. We did this by offering the $5 copays, the unrealistic benefits to their policyholders, which when you capture 76% or whatever of policyholders in a given geographic area, and that gives you power to negotiate with healthcare providers, the doctors, the hospitals. And so that started forming contractual relationships in this managed care scenario back in the 80s, and that really progresses today, and that continues today. But what it did was it absolutely failed to stop the escalating costs of healthcare. What it did do was solidify in the average American's mind the concept that health insurance and health care is part of their total compensation package. This is totally unlike any other insurance product that we purchase today. So much so that in 2014 we have an entitlement mindset. Now we have a federally mandated mindset, I like to say. We have an employer-driven healthcare and health insurance system. Health insurance is an expected component of employment. In fact, many people work just to have health insurance coverage. And comprehensive coverage, however, is really a thing of the past. You can kiss that goodbye. And it's interesting, this started about 10 years ago. This trend really started about 10, 11 years ago. One of the longest strikes in U.S. history involved billions of dollars for a grocery store chain out on the West Coast. And one of the things that the workers were striking about, anybody know about this, was a $1,000 deductible on a health insurance plan. Nowadays we would call that good health insurance. Well, my take on this is that health insurance versus reality. Health insurance is really misunderstood and is misused. It was never meant for non-catastrophic care. Think about the other types of insurance that we buy. You'll go to great lengths to avoid an automobile claim. You'll talk about your cousin's body shop rather than calling the police and getting them involved and filing a report with your insurance claim, or filing a claim with your insurance company. But one of the things that this has really done also that I think is detrimental is it's viewed as health assurance. If I have health insurance, I have health assurance. I'm covered. I don't need to worry about my health. This is really tragic because health insurance does not equal health care. I can attest to that. Because also, medical ethics does not equal business ethics. I was trained to do no harm and to do what's right for my patients versus the business world. And health insurance companies, health insurance is not really designed to benefit the policyholders. It's designed to benefit the shareholders because all policies are contracts written by lawyers who work for the health insurance companies. Few people are even aware of their policy details, as we'll see, and this is sold to the public via a carefully designed mix of simplicity and complexity. Let me illustrate. Which do you consider to be good health insurance? Which is better? $300 deductible or $2,400 deductible? I mean, it's kind of a no-brainer, right? Let's pretend that you have 20% or 40% in-network, out-of-network co-insurance, and your out-of-pocket maximum is $1,000 for the Cadillac plan, $300 deductible, or $3,850 for the high deductible plan. So what that means is that if you get sick, if you get hit by a train throughout the year, your total risk under the Cadillac plan would only be $1,300. Sounds like a great deal, right? Versus the other one would be $6,250. I mean, you might as well not even have health insurance, right? Wrong. Because let's talk about the difference between health insurance and a trip to Vegas. Which would you rather gamble? $300 or $2,400? $1,300 or $6,250? The differences between health insurance and a trip to Vegas are that if you risk $1,300, you're risking that over the course of an entire year. Versus the difference between $300 and $2,400 for me in Vegas for a guy like me would probably be about an hour at a blackjack table. Plus, not to mention the fact that it costs you nothing to get into the Vegas casino. But if you want to purchase this Cadillac $300 deductible plan, you're going to pay a very hefty price of admission premium. So let's talk about the door charges for the premiums. For the $2,400 deductible, it's $100 a month. For the $300 deductible, it's actually $571 a month. It's almost 6 times higher. So that for your year, the premium would be $1,200 a year, or $6,852 for the year for the $300 deductible. Now that price is to stay well. That is assuming you don't get sick, you don't utilize your health insurance at all. That is definitely out of your pocket. That's not involving risk. So let's say you get hit by a train. Let's add up these numbers. I like to use the deductible as, again, the price to stay well. The deductible is what you would spend out of your pocket before your health insurance kicks in. The premiums are how much you're going to spend to stay well for the year. And then your out-of-pocket maximums, add all those up, and for that Cadillac policy, you're going to spend $700 more total out-of-pocket. Now this data is from last year. This is from 2013, the Birdville Independent School District, where I went to school, Alton High School. And this is for teachers and employees of the school district back then. You can see these numbers I've highlighted. This doesn't even involve the middle policy, the Active Care 2 policy, which is the one I would wager most people are going to go for. Medium, or a large is too big, a small is too small, so let's go for the middle, the medium policy. Interestingly, under that policy, look at these total numbers. Your total out-of-pocket for the premium and your healthcare expenses for the year, if you got hit by a train, would be $8,600. It would be $1,500 more, or $1,200 more, than high deductible policy. Interestingly, I just completed an analysis of 5 local school districts, including the GCISD, and posted this on my blog. My blog is listed on my business card on the back. It's yourmoneyinyourlife.net for anybody who wants to read it. And the differences this year are even more striking than the TRS system. Just to take some examples, the total numbers spreadsheets are equal to the price that you'll pay if you get hit by a train or if you and your family get hit by a train. And you have to maximize not only your health insurance costs, but what your out-of-pocket maximum will be. Now I'm going to qualify this and say I don't know the details of these policies. What I'm going off of is based on the website, the benefits, enrollees information, and they're talking about the out-of-pocket maximum. So this is a very general guide, but I don't think it's too far off. But what's striking, let's just take the employee and the family over here on the right side, the very bottom lines, the differences between those total amounts. The Active Care 1 high deductible policy, if you get hit by a train, you and your family, you're going to spend $21,720. If you choose now the Active Care 2 policy, which, look a couple of lines up, you go from a $4,800 deductible to a $0 deductible, which is more attractive to people. They don't understand that by paying an insurance company to take on your risk, you're paying dearly, because if you look at that total number at the bottom, that is over $6,000 more that you're going to spend out of pocket for that Cadillac plan that has $0 deductible. Look at the difference in premiums alone, the top line. Can everybody see where I'm talking about? The laser here isn't that strong. The bottom box on the right side. The premium for the high deductible policy is $12,700. The premium for the lower deductible Cadillac policy it's over $3,000 more. So you have to really pay attention to health insurance. Am I doing this right? Usually I get a lot of gasps. So health insurance is a major part of healthcare costs, and unfortunately the media doesn't really get this correct. They're terrible at conveying this because they talk about the rising cost of healthcare, but health insurance is a major part of this, and now that it's federally mandated, I think those prices are going to go even higher. It's the number one concern of employers. We've seen double-digit increases in their premiums over the past 10 plus years. There's no end in sight. There's no end in sight to this. And in 2012, DFW employers paid $11,500 per family policy. That's not including the $5,000 on average that the employees actually kicked in. And so what do we get from this? Do we get health maintenance? No. We have a reactive system where the emphasis is not on health. The emphasis is on restricting you from accessing health care. You have to have symptoms in order to qualify for a diagnosis before you can receive treatment. Don't believe me? Let's ask Uncle Sam, see what he says. This is directly from the United States Code that established the Social Security Act, the top line, and it basically says that Social Security, which commercial insurance follows, will not pay for any screening services unless you have signs or symptoms first. So you have to have a lump before you can get tested before you get screened for cancer. You have to have diabetes before we can treat it, before we can look for it. This is really, in my opinion, not the way to go with healthcare. This is the essence of our restrictive system. This is followed to the letter, except for some very small changes that have been made in preventive care with the Affordable Care Act. Still to this day, you can't just walk in and say, I'd like to have something done. It limits your accessibility. And all of this because of the rising costs of healthcare. Who here hasn't heard this term in the past week? The rising costs of healthcare. Well, I call nonsense. It's not the costs of healthcare that are outrageous, it's the charges. What's the difference? By the way, I've never taken one business class, so forgive me. To me, the costs of something are the expenses incurred in the production, distribution, and marketing of a product or service. How much did something cost me, the widget? How much was my cost to produce this thing and get it out to my customers? The charges, however, are what I'm going to charge my customers to purchase my widgets. And there's a huge difference there. It's called the markup. The charge is equal to the cost plus the markup. So that, and I make this distinction not lightly, it's not the cost of healthcare that's crazy in the what I call ridiculous sphere. It's the markup, as we'll see. $12 for a Tylenol. $1,400 for a 30-minute picture of your heart, an echocardiogram. How about $60,000 for a 1-week hospitalization that does not include a stay in the ICU? One of the great ones is a $3,200 sprained ankle charge that I witnessed a few years ago. I'm an emergency physician by training and spent a lot of time in the ER. And for a sprained ankle, we're talking a splint, some crutches, an x-ray, and about 7.5 minutes of your time. Is that really worth $3,200? Even I don't think so. I guarantee if I was getting that, we would not have met. bottom line is that the charges are what's outrageous and overinflated. This is a bill for an ER visit to a freestanding ER in Dallas from last year, from 2013. This was on Channel 11. I didn't manufacture this. This lady went in, a healthy lady went into the ER for a cough and didn't have time to make by a regular doctor, so she thought she'd pop in and get some convenient care. She was billed $2,455 for this. Now, my favorite charge on here, this is for an hour's worth of treatment, by the way. There's 11 itemized charges on here for what was diagnosed with bronchitis. My favorite charge is not the $1,055 at the bottom there that she was charged just for coming into the ER. That's a good charge, and I like it. I really can appreciate that. My favorite charge, if you look a few lines up from that, you see $64.40. Anybody here have asthma or have a child with asthma? Have to have a nebulizer at home? Okay, the 3 cc dose of albuterol that she was given in this machine was charged $64.40. Anybody have a guess on what this costs me, what my rising cost of healthcare is in this? I'm sorry? I'm sorry, I can't hear you. $2, $3? You're close. It's 13.6 cents per dose of albuterol. Okay. And they charge her $64.40. But my favorite charge on here is the $580 charge that she incurred for the air that she breathed to be pushed through an oversized fish tank air pump. It's called a nebulizer. They cost around $50, and this lady didn't even get to take it home. So that's my favorite charge. In contrast, this is the receipt for my birth in 1968. This is for 6 days of my mother and I both in the hospital. Back then they kept you in the hospital. I don't know why. It was an uneventful birth. Well, I won't say it was uneventful. Excuse me. But it was a normal birth. There was absolutely nothing remarkable about it except for the product. So the bottom line is, for 6 days in the hospital, there's 17 itemized charges on here. You can see the total at the bottom is $406.80, of which insurance covered $396.05, which meant my father had to write a check for $10.75. When's the last time anybody here wrote a check? But he always said I was worth every penny. I feel real good. It's not a dollar a pound anymore. So this proves to you that I pay 13.6 cents. I pay $3.95 for 30 of these albuterol bullets, these 3 cc doses. That's my supply of Wacasey. So why is healthcare so costly? I would have said why so chargely, but that's not really a word. It's because of the aging, the sicker population, right? It's because of the unfunded care, the whole Robin Hood concept, where we've got to rob you to pay for somebody else who doesn't have insurance. It must be malpractice premiums, right? I mean, I can attest to these malpractice premiums. They are no fun. Or it could be jury awards. We're giving billions of dollars away to most of the lawyers in malpractice, as I wrote in the blog last year. It must be research and development, or my favorite is technology. Technology must be driving all these costs, right? All these charges. Well, I would submit to you that this MacBook that I'm presenting this on is about 1 billion times stronger, sleeker, faster, more memory, etc., and it just looks better than my Commodore 64 was in 1985. 1 billion times better computer, yet it costs about the same. So I would submit it's none of these usual excuses that we hear in the media every day. Instead, what it really relates to is consumerism, or a lack thereof. There's no free market forces in medicine these days, or almost none. The competition was limited back in the 70s and the 80s when all these contracts were formed into managed care environment. And without competition, without the free market forces of consumerism, you have no control on price. So much so that if you go to a store and you're offered bananas at $400 a pound, I think everybody here is going to just walk away. And I doubt that store would remain in business. But at 49 cents a pound, which is what we're used to paying, what we should be paying based upon the consumeristic free market forces that govern this price, that's more of a better deal. You're going to buy those bananas. But not so with healthcare. In healthcare, we've had almost no consumerism over the past 40 years. We have no competition for patients anymore. Instead, these managed care contracts I buy with Aetna and Cigna, etc. We have no price controls. There's almost no direct burden on the consumer. Instead, we have negotiated contract rates between healthcare providers and healthcare payers. consumers been kicked out of the equation. Some free market forces do exist. You have elective procedures that aren't covered by insurance. Everybody knows what these are. Plastic surgery, cosmetic procedures, laser vision correction. And this leads to a term that I call healthcareonomics, where high markups are necessary to bill insurers because only a certain percentage of the charges are allowed. Anybody ever look at your EOB or explanation of benefits and see that, well, gosh, they charge this, but the insurance company is saying that only this is allowed or legal. Well, the reason they charge so much is because they have to keep their reimbursement high. And I hate that term. Reimbursement means I give you some money, you give it back to me. It should be compensation, but I guess that sounds too politically incorrect for doctors to be taking compensation from insurance companies. That aside, anyway, reimbursement, if I'm going to sell my house and I want $100,000 for it, I'm not going to ask you to pay me $100,000. I'm going to ask you to pay me maybe $120,000, $140,000. But we hopefully will land somewhere around my sought price. And that's the same deal that occurs with these contracted rates with insurers. I charge you $580 for breathing, for the air that you breathe. Maybe I'll get $20 out of you. And in order to bill insurance companies, I don't take any insurance in my clinic down the street. I just charge people a reasonable fee. It's cash only. I don't have any claims processing. I don't have any extra staff, and I don't have to deal with rejected claims or delayed payment. I like to call it one and done, where you get the bill today and that's it. I wouldn't even know how to bill it. But this billing and coding and compliance and regulatory nightmare has led to a tremendous increase in the amount of people required, I guess, to run healthcare. You can see this graph here, the product of the physician's output from medical schools and foreign medical grads have been pretty steady over the past 40 years, but look at the growth of all the healthcare folks who have a handle in it that wouldn't know which end of the stethoscope to listen with. I'll give you a hint. You listen with both ends. But over 30% has been estimated of healthcare costs or revenue that goes towards administrative expenses. I think that's a little bit undershot based upon this graph. But all of that is really not what I'm here to talk to you today. What I'm here to talk to you about is what I consider to be the real American healthcare crisis. And it doesn't have much to do with the economics of what's going on. What I'm concerned about is the great missed opportunity that we've had over the past 70 years. Since World War II, technology has come about that's made it possible for you to monitor your health and keep your health longer and better than ever before. Because our health, just as these letters are on the beach in the sand, they're prone to being washed away by the next wave. So is your health at any time prone to be taken from you. And yet, with our restrictive, reactive approach to healthcare as mandated by the managed care organizations, we're not taking full advantage of what exists out there. How many women in this room have ever had ovarian cancer screening? Anybody ever heard of it? Oh, Sean has. Okay. So, ovarian cancer is something that kills 20,000 women a year developed in the U.S. Over 2/3 of them die. And the reason they do is because it's caught at such a late stage. It's impossible to find this. In fact, a new article just came out a few months ago that talked about how the routine pelvic examination every year is useless at finding ovarian cancer. Hilda Radner, anybody remember Roseanne? She had an ovarian tumor that was the size of a grapefruit before they discovered it. And look at what size she was, if you remember, she was about 5 foot tall and very thin. We have the technology to detect this. There's a blood test that exists. It picks up 80% of these tumors. In other words, 80% of these tumors secrete this marker. If we find the normal levels of it, we can follow it to get a pelvic ultrasound and diagnose it very early on. We should be doing this every year on women across the U.S. Why aren't we? Go back a few slides to the rising cost of healthcare, right? Don't you know? I'm telling you, I do this test for $35. And I do them all day. You don't have to ask permission or anything from your insurance company. We should be doing this for everyone. The test costs me $12, so I'm making a pretty good profit. We have the technology. We should be doing a proactive approach in our health maintenance programs throughout the country. We should be doing screenings. We should have early detection. It is inexpensive. I'm telling you, my most expensive antibiotic that I administer in my clinic is $2.17 for the dose. We have the technology. We should be saving money and saving lives. And if you don't think this is important, it can happen to anybody. Let's ask Daryl O'Connor what he thinks about it. In 2002 in July, he missed the pregame warm-up and was found dead in his hotel room from a heart attack. Now, this 33-year-old world-class athlete, by anybody's definition, the very picture of health, had been screened. He had been put through some pretty rigorous screening, but they had missed the fact that he had a huge family history of heart disease. They discounted the idea that a 33-year-old isn't going to develop blockage that severe, but lo and behold, he did. And he's no longer here to tell us about it. So this can happen to anybody at any time. We all, and this is what really gets me another concept of wellness. If you go to the gym and you eat right, you're healthy. Well, I mean, that's not true. You could have a ticking time bomb inside of you that's ready to go off at any time. So we should be looking for these things. Now, Daryl Kyle's example is one in a million. You hardly ever hear about that. But let's talk about something that's so common. It's the #1 cause of death on school grounds every year. Sudden cardiac arrest. On average, every 3 days, a child or a student drops dead from this condition across the U.S. Now, you hear about the kids that go up for the three-pointer and make the last game of the season, the game-winning shot, and then they collapse afterwards. We hear about those in the media. We don't hear about the 7-year-olds, the 11-year-olds that died suddenly and quietly on the playground. But this condition exists, it's out there, and a school physical does not pick it up. That's why I charge $15 for my school physicals. You get what you pay for, which is really not much. But with this condition, you have an enlargement of the heart muscle that I can't find with a physical exam. It's very rare that I'll find it. I heard a heart murmur the other day. First kid of about 100 that I've screened so far this year. Heard a heart murmur, told his mom she was not very happy, I have to say. Because he was ready to start football the next day. But I heard a murmur, I said, look, you have to get cleared by cardiologist. But it's very rare that I hear these things. We can only pick these things up with echocardiography or EKGs, with an ultrasound of the heart. Something like this that shows that thickened, enlarged muscle up there. And this thickened muscle is responsible for creating electrical derangements, if you will, in the wiring of the heart that cause sudden death. This is the only way to really pick this up realistically. But we're not doing the screening test on kids. Why aren't we doing it? Because it's so expensive. It takes about half an hour to do this in an EKG. I charge $99 for them in my clinic. So, the future. What holds the future for us? Are we going to have a government health plan? Are we going to have single payer and Medicare and Medicaid state, or the so-called Obamacare? Are we going to go the way of the other countries, Canada, England, Germany, etc.? I don't think so. Because I think that the future is now. Change is here. Health insurance, you're going to get less. You're going to pay more. You're going to get less. You've got reduced coverage with higher deductibles, higher out-of-pocket maximums. And so what I would like to leave you with is the idea that if you have a high deductible health plan, you are now a consumer. And you should develop consumer tendencies just like you do when you're talking about shopping for shoes or shopping for a restaurant. Anything that you apply those consumer tendencies to, start applying those to healthcare. And I think you can save some serious money. You can get better healthcare in the meantime. I like to say that there are some things that health insurance should buy, for everything else there's MasterCard. And I really believe that we should start using, as a country, health insurance the right way. And that, I think, is the key to change. Thank you very much. Appreciate it.